We have here 38 years lady. She has undergone a hysterectomy and her symptoms have still persisted. So now we are doing a transvaginal scan, and here I am at the perineum. You can see that there is a urethra. This is the urethra which leads us to the bladder. So bladder is on this side, and now the probe, we are entering into the transvaginal probe. The anterior and the posterior vaginal wall is seen separating, and here when we come inside, now I can see this is the cervix. So here you have the external os and the cervical canal which is seen, and I can see some bowels moving very freely in this compartment. Then when we go into the posterior compartment, here I can see the bowel wall. So this is the bowel wall, and we are following the bowel wall now, and as we follow this in, you can see here this is the retrocervix. Here you have a nodule. This thickening is the retrocervix where the bowel is adherent. So this is the lumen. So you can see hand in glove appearance of the bowel at this part. Here you can see multiple loops of bowel adherent to this part, like loops like this, and this is the length of, this is the nodule which is present. Okay, so this, when we follow here, we see severe, this one is the classic nodule, and then when we follow up, here you have the normal regular bowel wall. Okay, now this is the retrocervical area. This is the thickening of the bowel wall, but the actual nodule is here. So she is a case of subtotal hysterectomy. So actually, because of these adhesions, maybe they were not able to go down and they did a subtotal hysterectomy. So the pathology still remains and the patient continues with her symptoms. So she has no other option but to complete the surgery now. So here we are going to require the excision of the remaining cervical part of the uterus, the retrocervix, and addressing this bowel endometriosis. So yet again we have to understand all those myths that hysterectomy will treat endometriosis, or removing the ovaries will take care of her endometriosis. These are all false understandings that has to change. So here you can see a classic nodule which has remained after hysterectomy, and the patient has severe bowel symptoms and she is absolutely not relieved. So we will redo her surgery. Thank you.